All right.
Can you see all your slides before we do any more questions? Because I'm scared we're going to run out of time.
And you just think I got some nuggets of wisdom in here that you just don't want to miss. So I got, less than 15 minutes to try to get to them. All right, so we have heard the mandate. No more questions till I get done. All right, so here is our strategic direction. Preventing suicide and suicidal behavior. Oftentimes we say suicide, which is just the deaths, but we often want to talk about, non-fatal suicide attempts and other forms of suicidal behavior and self-harm by strengthening connectedness, building and strengthening connectedness within and among individuals, families, and communities. So how can we make sure that people who have a broader social network, not just individuals, but even kind of that within communities, it really kind of goes to some of the coalition stuff. How do you make sure that organizations that are the helping organizations, that the ones that are out there doing the programs, how can they be connected to each other? And I talked a little bit about, turf issues, and you guys have probably experienced that too, that sometimes the social service folks don't want to work with the school folks, and sometimes school folks don't work with the medical folks, and sometimes the medical folk don't want to work with, the law enforcement folks. And so that's part of the issue too, that again puts our communities at risk when you even have at the organizational level, folks don't want to work together because they're suspicious. And so I know all of you in this room, you're not, you don't do that. And after today, you're going to get out and create some of those networks and try to work those things together. But definitely that's part of that connectedness, is not just individuals, but even at organizational levels, can we get organizations connected to each other, sharing information, sharing personnel, sharing staff, sharing resources, so that they can be much more effective in what they do. So that's part of what we're going to try to focus on. This is just how we developed our strategic direction. We did some internal review of what were some areas of need in regards to suicidal behavior. We looked through some of the literature, published literature, identified several different options. We then drafted up a document. We consulted with some experts from outside of federal government, some from academia that they could come in, some from state health departments so they could come in and give us some advice on, is that reasonable? Is that something feasible? Is it something that we could actually do? Does it make sense? Because I mentioned that, federal government people are not always dumb. Sometimes we can't get very focused on one thing, and sometimes you need some reality check from people who are outside of government to come in and to tell you, that thing, no. I don't know what you're talking about over there. You need to reorganize that thing and re-come up with another idea. So we made sure we brought in some people from outside of government to come in and give us some advice on how to come up with this. So what about connectedness between individuals? So we're talking about social ties, access to and use of social support, especially in times of stress. What are some of the benefits of close and supportive relationships? So there is, some research that shows that connectedness, especially between individuals to other individuals, I'll get to the next part in a minute, actually does prevent some maladaptive coping behavior. So when someone runs into a stressful life event, when they run into a diagnosis of cancer, a diagnosis of HIV, or they have a relationship breakup, or they have some sort of school problems, or they have some conflict with their parents, that all of a sudden an option is not suicide. Their option is they're going to call somebody. They're going to get with somebody that can help them. They're going to talk with their friends. They're going to do something else, and the option is not, I'm going to go and I'm going to hurt myself. So these are some of the things that we found, that there was research to support that connectedness between individuals actually is a protective factor. And so then we moved on from there. Oh, I should tell you too, because I know you guys are fast scribbling down some of this stuff. We've got it on our website. There you go. Oh, man. I should have told you that before. I should have told you it's on our website. Actually, the whole process of how we went through this strategic direction, I don't know if exactly worded, well, the wording is there. Now, I'm not sure if they put it exactly, because I made it pretty, but I don't know. But all of that language is on our website. And anyway, so if you go to the Injury Center's website, www.cdc.gov, and then the /injury, and then you can search for connectedness or go to the suicide area, and you should be able to find this. Whew. All right, good. Yeah, so there was going to be a lot of writing. Yeah, there's going to be a lot of writing. All right, so that was connectedness of individuals to other individuals. There's also connectedness of individuals to their families and to other community organizations. So has that demonstrated that that can work? Well, yeah, they found that, when you connect people to their schools or to their places of employment or to their faith-based organizations, they actually do better. When they feel like there's someone I can go talk to, or I feel like my employer is supportive. They got their employee assistance program set up, so I got a confidential person I can go and talk to when I got some trouble. If they know that those kind of things are set up for them and they have access to it, it actually is helpful. Increase the sense of belonging, access to formal helping, and then group responsibility when they know that there's some other people that are looking out for me. They know when I've missed work a few days, or they know that I've got some financial problems, or maybe my buddy knows I've been drinking a little bit more than I used to. Now, it's not left to the individual always to go seek out help, but sometimes that buddy says, I think you need to come and talk to somebody, or talk to me. I'm seeing something going on here that's not good. So you can do that kind of thing. All right, and then connectedness across organizations. So connecting educational with health, with social service, with criminal justice, and formalizing those relationships we found in other community coalitions. They've done a little bit more work on this in some of the work actually in HIV, some of the work actually in intimate partner violence, that they found that when you get these organizations, again, sharing resources, communicating information together, that they're actually better, they produce more effective programs because they're working together. As opposed to, we're going to do our stuff over here, you do your stuff over there, they do their stuff over here, and people oftentimes get lost. People in the community get lost between one or the other. So we're going to start to try to focus on some of this in regards to suicide prevention. I talked about, turf battles, that this is sometimes the way things happen, is that sometimes they're arm wrestling over, who's going to get this, who's going to get that, and they're fighting over it as opposed to working together. So. All right, so there's my 2 slides with the pictures, right? So now you see everybody working together and all that sort of good stuff. So collaboration actually does make a difference. Our strategy is part, measuring the scope. Again, you've got to have some of the data that help you in terms of moving the program forward. But data, that's the area I work in, is collecting data. Data is not the answer to everything. You got to have data, but you got to be sensitive to what the community is dealing with too. So while you want to have that information, you want to be able to categorize, how much of it there is, what's happening, is it going up, is it going down, that kind of stuff. You also want to be listening to the community to say, these are our priorities, or this is where we think something is going on, this is what you need to address here. I'll tell you this story. One of my coworkers was assigned to a community to do some work, in violence prevention. And so she went to one of the community meetings. She had done, her research, and she had all the data, about how many, youth homicides there were and all that sort of stuff. Sat down at the meeting, was listening to the meeting, and one of the older ladies got up and said, that stuff that you presented was very nice, and and that, you're showing that we have a problem, but I'm worried about where I'm gonna get some toilet paper. And so the reality of what was going on in that community was very different. I have some basic needs that I need taken care of now. And yes, violence is a problem in my community, and maybe I don't feel safe walking to the library. I need some toilet paper. So you got to make sure you try to address what are some of the reality needs in that community, and then, show how what you're bringing, what you're doing here in the community is adding on and making this community better. Because if you probably, I'm not sure exactly how all of that turned out, but if you didn't bring LA some toilet paper, she wasn't going to have any interest in your youth violence prevention program tomorrow. She wasn't going to be back at the next meeting, probably not. All right, so I only got a couple of seconds here. So again, measuring the scope is part of, getting some of the information. New approaches to prevention, and that's part of what we're doing. Kind of this bottom one is looking at other interventions, and one of the things that we've seen, a few years ago, again, Surgeon General Dr. Satcher put together a document looking at youth violence prevention. one of the things you see there when you talk about youth violence, interpersonal violence, and youth self-directed violence is a number of the risk factors look exactly the same. Substance abuse, family dysfunction, problems with peers. So while there has been a lot more research on youth interpersonal violence and showing which programs are effective, because they're targeting the exact same risk factors, many of them have not been tested for suicide, but I'd be willing to bet that some of those same programs, if you tested them out and did them and looked at suicide outcomes, I bet you'd find youth suicides would go down too in those communities. So that's part of what we're also trying to look at, is some interventions that have been used in other areas that are effective, that are focusing on some of the same risk factors. They probably work for suicide too. It's just that they hadn't been tested out, and so that's part of what we're going to be doing too. All right, so we're trying to adapt what works. Building community capacity is another thing. What are some of the challenges for the future? Definitely, avoiding duplication. Funding is going to be an issue. What kind of interest and support, and identifying some of those effective programs. All right, so what about our strategic direction and our conclusion? We identified an area where we think public health can make a valuable contribution. Prevention requires a broad range of partners, and that just kind of goes to the issue of developing some of these community coalitions and partnerships. There are many opportunities to improve information, determine what works, build capacity, and I think we are poised, and many communities are poised to make a difference as a result of collaborative planning. All right, that's it. Now, there isn't a whole lot of time, but a little bit. Thank you very much. So I talked about our research project with regards to alcohol and just showing that alcohol was a problem across many communities and many populations, and then also what we're doing in regards to connectedness. I think her hand was first, and then I'll go back over there. I think you were first.
I can answer the question, if you can go back to the public health approach prevention slide, so I can put it right there.
All right, yes.
I wanted to ask a question. With those, the connectedness piece, was there some research and statistics that indicate that when that project and when you use these variables and set up your program as such, what evidence you had to show that it was successful? I mean, is there some research behind that?
There's definitely some research behind it, but not as much specifically for suicide. We looked at connectedness in the area of substance abuse. There's some good evidence for programs in regards to connectedness and substance abuse. There's a few programs in suicide prevention that have connectedness. What we looked at, there's a much bigger body of literature is what we call it. There's much more research in the area of healthy youth development and connectedness to show that you can help adolescents in terms of their trajectory into adulthood and becoming productive citizens if you've got some connectedness pieces, for them with their families, for them with community organizations. So there's a lot more evidence in regards to healthy youth development in regards to connectedness. But what we were seeing is that there was a lot of opportunity for doing that for suicide, because some of the same things that they were talking about, that was the thing that we were looking at the literature, some of the same things that they were talking about in regards to, like I said, substance abuse or healthy adolescent development were some of the same stuff we would be looking for if we were talking about a specific suicide program. So we said all we think we need to do is take some of those programs, adapt them to suicide, and then measure suicide as an outcome.
So you guys were doing some pre and post things, so before you did this program, you did some kind of survey, and then afterwards?
Yes. And actually, I should say that we haven't actually implemented a program yet, but what we've done is we've developed the initiative. This is what we want to do. And so while we're looking at some of the literature and kind of planning out what we're going to do, we based it on evidence, scientific evidence.
Would you, and it's okay if you say no, I'm okay with that. Would you consider the possibility, I have my jump drive and I can take the email and you can let us get the slide?
Oh, you want the ones on the connectedness stuff?
Yeah.
Oh, yes. If you want
their email, I'll send it to them.
Okay.
You're comfortable with that.
Oh, the website that's got this stuff, and we've actually got a one-page document that talks about connectedness, because oftentimes when you go and talk to policymakers, you got to put it on one page, in order for them to digest it. And then we've got a longer one that's about 12 pages that gives a lot more background in how we developed it and such like that. Okay, anyway, www.cdc.gov/injury. Yes. And then once you get there, you can either search on connectedness, or you can look for the suicide hypertext. And then once you get to the suicide hypertext, it'll be in there amongst all the other suicides. Just suicide. And we've got all of our suicide prevention stuff under suicide, so when you get to that page, you'll do it. Probably connectedness will take you more directly to it. The suicide one will give you all of our stuff that we're doing in suicide prevention. Yes?